I'm Dr. Frank Simo. I'm a board-certified facial plastic surgeon and otolaryngologist, and I practice with SLUCare Physician Group. Well, I've been in practice for over 30 years, and I specialize in plastic and reconstructive surgery of the face. I basically see people who have nasal issues. Many of them have had previous nasal surgery with undesirable outcomes. We treat aging face, and we do repair of cancer defects after patients have had skin cancer surgery for facial and head and neck skin cancer. We also do injectables in the office, which are office-based treatments like Botox and fillers and other treatments like that. And those are very popular nowadays. And there's quite a few patients who come in to see both myself and Dr. Chen for all of these types of treatments. I think the main thing you have to do when you meet a patient and when you speak to a patient is to be honest with them and really give them, not only give them hope, but to give them a real idea of what's going on with them, okay? And I think that patients are able to grasp their situation, especially if we're talking about the skin cancer patients. Many of these folks feel that they're going to be deformed for life, and in reality, most of these people, their outcomes are such that 6 months later, no one can look at them and tell that they'd had the surgery done. Well, I've always believed in excellence in medical care and trying to treat patients at the absolute maximum that your hands and your mind and your body can do. And I think that dovetails well into the mission that SSM has.